Hello, John. I hope you're doing well today. We're meeting because I wanted to discuss with you the results of the Beck assessment that you were given a while ago. If you remember, we did the Beck assessment to assess you for depression, anxiety, and suicide risk since you sought out therapy for feelings of sadness. You had some depressive-like symptoms, and so we agreed that doing this assessment would be kind of a good first step in a treatment plan. I will try to explain the results to you in a way that you understand, and if you have any questions at any time, please ask. The first piece that I wanted to talk about is the results of the Beck Depression Inventory 2, which is supposed to assess the severity of the depression or any depression that you might have. And it's the severity of symptoms. So I'm not saying that you have depression. These are just severity of symptoms. The first thing that I want to address is in one of your answers, you agreed that you would kill yourself if you had the chance. John, the very first thing that I need to ask is, are you contemplating suicide? And if you are, can you tell me how immediate that threat is for you right now? Have you contemplated how you would do it if you were to kill yourself? Okay, well, I'm really glad to hear that you're feeling good today and that you don't have thoughts of suicide. Well, to move on, you answered a few things on the Beck Depression Inventory, like, I'm sad all the time, I am disappointed in myself, I cry over little things. This assessment is showing that you're experiencing considerable distress and that you are at a severe risk for depression and depression symptoms. You also told you also used the tool, the Beck Scale for Suicide Ideation. On this assessment, you did indicate that you have a strong wish to live and a weak wish to kill yourself, and that you have no desire actually at all to kill yourself. Because of your prior statement, there was a little bit of contradictory information that was given, because on one assessment you stated that you would kill yourself if given the chance, and on the other one you stated that you really had no desire, little or no desire to kill yourself. So, we should probably eventually talk about some of those contradictory statements. Now, to move on, the Beck Hopelessness Scale is showing that you have a moderate amount of hopelessness about the future. In it, you stated things like, my future seems dark to me, I just can't catch my breath, and I can't catch a break, and there's no reason why I will in the future. These statements indicate that you do struggle with a certain amount of hopelessness. The next assessment that we're going to talk about is the Beck Anxiety Inventory. What this does is it assesses your anxiety level, and some of your anxiety symptoms can kind of pair with depressive symptoms. So it's really important for us to see what are some of your triggers. You did have quite a few anxiety markers, some with a moderate amount of effect on you, such as unable to relax, feeling hot, feeling shaky, having a fear of losing control, difficulty breathing. This level of anxiety, coupled with some of your scores from the other tests, indicate that you have some anxiety and a severe level of depressive symptoms. For your future recommendation, I would recommend continuation of therapy, and we might want to discuss meeting with a psychiatrist to talk about maybe medications that may be able to help you with some of the overwhelming feelings that you seem to be feeling. In the meantime, I think that we should discuss the safety plan and talk about your support system in case your feelings become overwhelming at any point.